also with us, Leticia Plancarte, the newly appointed Director of Imperial County Behavioral Health Services, and also with us, Rebecca Terrazas-Baxter. It's the Letty and Becky Show on AM 1230 and FM 107.5. Ladies, good morning.
Good morning, Carroll. I think we like the sound of that, the Letty and Becky Show.
Yeah, hey, I can make it happen. I have friends in the business.
Or that duo.
Okay. Letty, first off, I know it's official, but you have been serving as the interim director of the Behavioral Health Services for, about a year now. So it's official. You are the newly appointed director, and congratulations on that. But it's a department I know right now that you've got help available to those of us that have been facing the trials and tribulations of the pandemic. And some of the services that you have available that can help all of us get through this, right?
That's correct. And I want to thank you for the invitation. And also just for clarification, I was interim since September when Andrea Cullen retired. So it was about 5 to 6 months. And, one of the things that I'm glad that we're doing and reaching out to the community. We have been seeing the waves of the pandemic, and now we're talking about a third wave, and it's not so much related to the COVID, but more related to the mental health problems that we see coming after a traumatic event. There's always some social, psychological impact in our community, and I think that's where behavioral health comes with services for mental health and substance use disorder problems for our community members.
Well, it's, to relate it to post-traumatic stress that, very much in the news for military, and it also affects people that have been, going through things like a pandemic. Things are not normal.
Exactly. And one of the things that everyone needs to realize is that we have all been impacted in different ways. It could be that we lost a loved one, that we are facing financial problems because of unemployment, because of isolation. There's been separation of families. So it is impacting many of us in different ways. And we need to be aware of what is the effect on us individually. And one of the things that we know is that there's always been stigma related to mental health, of reaching out and getting help. And that's one of the things that really limits access to individuals. So we need to talk about it. We need to tell people it's okay to reach out, to get help. If this is not your normal self, if you're feeling depressed, anxious. One of the things we have noticed is that our clients who were receiving services before, because of isolation at times, their symptoms have exacerbated, and we want to make sure that they know that we're still here. We are making every effort to connect with individuals, but with the pandemic, we have faced some challenges.
And I think we have all faced those challenges in one way or another. As you pointed out, losing a job, not being able to pay your bills, losing a loved one. And that, we report numbers almost daily. And you have to stress the fact these are not numbers, these are people. These are aunts and uncles, grandmothers and grandfathers, mothers and fathers, siblings. These are people in our community, and the numbers are staggering. So
yes, one of the things we have seen is that many, like I mentioned before, many of the individuals are coming with more severe symptoms. But we have also faced that there are certain populations that have not, where the referrals have decreased, the numbers have decreased. And that's primarily in the children's and adolescent programs, where most of the time the youth gets referred to us because in school teachers observe when something's going not okay, so they refer to us. And because kids have not been in school, there has been a decrease, and it's not because the problem is not there. It's just that those barriers of not having the immediate access to those kids has really decreased the identification and accessing services. With other populations, like I mentioned, we see a decrease. However, there has been an increase in some of our substance use services. And, as we talk about this, I just want to make sure that the community is aware that we have stopped operations. We have continued to provide services in our three main cities, Central, Calexico, and Brawley. Even in our San Pascual Winter Heaven Clinic, it's open. We have reduced the access to the clinics, and we do see individuals on site if needed, but we have moved to provide a lot of our services through telehealth as much as possible. So we do video conferencing, and if the individuals are not able to access video or Zoom, then we continue to provide services by telephone or in person if needed.
Okay, and I know Weekly, Let's Talk About It, offers help on the air as a podcast on the internet, and some of the services that you do provide include just somebody to talk to, right?
Yes, we continue to offer assessments, which is the first step in anyone wanting to access services. We need to do an assessment to identify their needs and then refer them to a process. Doctors continue to work. We have psychiatrists that are providing services on a daily basis. We also have therapists who provide counseling in all of our clinical divisions. And we also have rehabilitation technicians who provide a lot of one-on-one assistance, linking individuals to needed resources. As you mentioned, in regards to the outreach to the community, we do have the radio show, Let's Talk About It. We are putting in the newspaper, radio show, television. We've done some interviews, bus stops, social media. We're trying to let people know that we continue to be open for services and that we're here to provide the services and the support that they need. Okay.
Becky, couple of quick questions in your direction. The county also offers help to, small businesses and individuals through various programs as well. I know actively involved in helping people eat, which is important to life.
Yes, we've offered a various number of different programs for whether it's businesses or individuals, offering utility assistance, also some rentals that we've offered, some small business grants as well, and some loans that became forgivable loans, so technically grants. So we've done quite a bit of different programs to try to help people throughout this pandemic. I think we've expended about just over $4 million, maybe $4.5 million in funding, and that's from CARES Act funding, but also a combination of the public benefit funds and programs that we have here as well that have been appropriated to offer that type of assistance to our residents and our community.
Okay. We learned this week that Sacramento, again, changing the rules. And as of this week, the state is going to allocate 40% of the COVID-19 vaccine available in the throughout the state to underserved communities. And if I read my information correctly, Imperial County falls in that category, right?
Yes, that's our understanding as well. I believe we are awaiting some more specific clarification on this new change, but there's a new tool that they are utilizing in order to prioritize the distribution of vaccination and other services. And so this new tool is called the Healthy Places Index, and it goes off of index quartile percentages of different factors that they take into account in order to determine how healthy a community is. And we are pretty low on that index, and so that I guess helps us to it benefits us in some way by finally showing them that we are drastically in need of additional vaccines in this area. So I think that helps to strengthen a little bit of our argument as well as far as the equity of the distribution of vaccine allocations. And hopefully this was, part of that advocacy effort that we've been really pushing for quite some time at all levels of government to share that, that is really something that needs to be taken into account. So yes, it's another change, but I think for us in this aspect, we're a little bit happy with this change because we're hoping for a more equitable distribution now.
Okay, and as I refer to the governor's plan, the Skittles plan for reopening the economy, we have been in purple almost from the get-go. It appears, if the numbers continue to hold, we'll be able to move into the red Skittle category.
Yeah, definitely great news that we were happy to announce earlier this week. As you mentioned, we're currently in the purple tier status, but we have been meeting the metrics of red tier status and actually even orange in some of our different levels for over a week now. However, the state only allows us to move one tier at a time, so we would only be able to move to the next tier, which is red, and we would have to meet those metrics for at least 2 weeks before moving. So as I mentioned earlier, we've been meeting it for a little over a week now. So if we continue in this direction, we should be able to move into the red, less restrictive tier by March 9th, which hopefully would be next Tuesday. So it's great motivation. We want to encourage everyone to continue doing what they're doing. Keep social distance, wear your face coverings, take any other additional safety measures that you can take to reduce the spread of COVID-19. But as you mentioned, that's definitely something good. And we're happy how this will change, businesses as far as retail, restaurants, and recreational activity. They'll be able to do a little bit more.
And, one of the ways it will help, and I know it sounds strange, but get tested. And, get tested and come back negative. Because if you get tested and you are negative for COVID, that is a positive for the metrics in Imperial County.
Yes, definitely. That is definitely a positive for us if you get tested and test negative. And so we hope to be able to reach that tier by Tuesday, and hopefully we'll have some more good news next week for everybody.
And maybe 2 weeks after that, we can become an orange Skittle.
Definitely. Let's keep pushing for that. It's going to take all of us to keep doing what we're doing.
Okay. And everything else at the county moving ahead, right?
Yes, sir. Everything else, we're pushing ahead, still have to do our everyday activities along with, this new additional challenge that we've been addressing for the last year. I'm actually out at the vaccination clinic right now. We're conducting our second dose vaccine for the seniors population of ages 65 and plus that were out here on February 4th. So they're now out here coming back for their second dose, and it's running quite smoothly.
Well, it's something that Imperial County has had experience with running the drive-through flu clinic, and it has worked well. The only issue has been the lack of vaccine, and that may be improving now.
Yes, definitely. So that's our hope. We're definitely hopeful that that will be improving with this new Healthy Places Index that they're utilizing in order to determine how they're going to distribute vaccines.
And I was able to navigate the state's site, and I did see that at least 92243 is in line for additional vaccine. And
yes,
I would assume the other zip codes in the county as well.
Yes. So as most of the county, I believe so, is in a, there's different colors. So you were talking about Skittles earlier. If you look at that Healthy Places Index map, it has different colors, and I believe we're the darkest one there, which I believe is dark blue. So that means we're on the lower quartile there, and hopefully that will influence their decision making.
Okay. Ladies, did we miss anything that we should talk about? I guess not.
Carol, I think you wanted to know about total population vaccinated.
Yes. Basically, last week, our assemblyman said when you work out his numbers, roughly 10% of the population had been vaccinated by last Friday. And where do we stand?
So actually, at this moment, just over 11% of our population has received the first dose of the vaccine. As far as fully vaccinated, because keep in mind we have to conduct 2 doses, that consists about just over 4% of our total population has received both doses. I'm at a vaccine clinic right now where a large part of our population, just over 1,000, are going to receive, not a large part, but a good portion, are going to receive their second dose. So hopefully that percentage will go up and will continue to go up. I believe we'll be conducting another one for the participants in the clinic of February 11th, the following week. So they should be receiving notifications soon.
Okay, and I encourage, and I know the county encourages individuals, register at every possible site you can. The state site is almost impossible to navigate, but the clinics, I know Walgreens and CVS pharmacies and any other site, get your name there so that you can get in line for the vaccine.
Yes, definitely wherever you can. And as soon as the My Turn site becomes available and becomes active, that's another place you might want to register as well.
Okay. Ladies, you have a safe weekend, and we appreciate the visit today.
Great. Thank you.
It's like a trip through time. The Imperial Valley's best oldies on the radio.